and welcome to the Back to Movement podcast. I'm your host, Bernadett. Have you ever wondered how regenerative medicine can support your journey to recover from back pain? Is it the right option for you? Stay with us because we are diving into this topic with a very special guest. Today, I am thrilled to welcome Dr. Tejas Ozarkar to the show. Dr. Ozarkar is a board-certified physician in physical medicine, rehabilitation, and pain medicine. He specializes in interventional orthopedic injections and regenerative medicine treatments for neck, back, and joint pain. Dr. Ozarkar also serves on the American Academy of Orthopedic Medicine Board and was recently appointed to the Texas Medical Board District Review Committee. And I'm so excited to have him here today. Thank you so much for accepting my invitation to the show.
Thank you for having me, Bernadett.
Thank you. So tell us, what inspired you to specialize in treating pain? Was there a moment or experience that shaped your approach?
Well, as I was growing up, I grew up in this area in Plano, Texas. And as I was going through high school and middle school, I noticed that I was prone to musculoskeletal injuries. In fact, I dislocated both of my shoulders a total of 9 times. And I never really knew why. And my parents took me to see physicians. By the time I saw that doctor, my acute injury had mostly resolved because I was young and otherwise healthy, but I was always prone to injury and I never really understood it. And it really restricted the types of activities that I wanted to do or it restricted me from the activities that I wanted to do. And so I was on the swim team. I had to quit that early because I was dislocating my shoulder in the water and it was becoming unsafe. And I just didn't really understand what was happening to me. And so part of my journey is I was accepted into a program at Texas Tech, which I'm representing today. I started there as an undergraduate, and I was involved in a special program that accepted me into medical school early. And so the benefit of that is I got to, without having to worry about, focusing on grades and extracurriculars and that kind of stuff, I really got to look at all of the specialties that were available in medicine, and I got to shadow a lot of physicians while I was at Texas Tech. And also when I would come back home to Plano, I would shadow as many different physicians as I could. And I had an amazing opportunity to shadow a physiatrist, which is what I am, a physical medicine and rehabilitation specialist. And I had never heard of it before. My parents had never heard of it before. None of us had really ever heard of it before. I wish I had seen one when I was 10, so I could have probably changed the course of my musculoskeletal journey personally. But it was such an incredible feel to me because there was a lot of patient interaction. There was a procedural component to the specialty. So I got to use my hands, I got to use my brain. And what I could tell, even as a teenager, was there was so much growth in this specialty because at that point, this is a couple of decades ago, there was a focus on steroids. There was a focus on surgery. There was basically the entire field of movement, the entire field of facilitating movement through things that help the body rebuild tissue to help the body become more resilient. That was totally undiscovered. And even at that point, a couple of decades ago, the various physiatrists that I had an opportunity to shadow acknowledged that. And so I just saw potential in this field. And I so wish that I had an opportunity as a younger me to have a specialist like me and some of the colleagues that I work with to give me some guidance so I could enjoy activities, so I could continue swimming or whatever it was. I just stopped to prevent injury. And although that's a safe way to prevent injury, um, you know, I don't know how it would have changed the course of my life, but I would have loved to be a more active person when I was younger, because I think it would have fostered healthier
Mhm.
relationships into my adulthood. And that's what I want for my children. And that's what I want for the next generation.
Yeah, yeah, definitely agree with that. Do you do any physical activity now, or?
So I primarily do just high intensity training
Mhm.
and just kind of a focused workout, but I don't really have any physical activity that I very much
Mhm.
enjoy. I
Mhm.
do it as a chore because it's a part of my
Mhm.
day, and I've learned to do things that I can enjoy with it, like watch a show or something like that as I'm doing some of these activities or listening to a podcast. But yeah, I look at my younger self, and I could have developed so much more. I could have been so much better at sports, and it could have been a real part of my life. But when you're dislocating your shoulder at 15 a couple of times in the same year,
Yeah.
you basically just stop everything.
And I think you get also fearful. You have fear of movement. Like, oh my
Absolutely.
God, what's going to happen if I move now?
A lot of
You know,
apprehension, and my parents had apprehension too, so there's just I
I,
could feel it, and I had I had it internally, I had it around me, and that's what we knew to do, was to just stop doing any of that.
yeah, I can imagine that. And stop doing that. You mentioned that you prevented the injuries, which is true, but you were also probably fearful of movement, right? You were never
Absolutely.
confident that,
Absolutely.
it's always in back of your mind that, oh my God, what if I do this? What's going to happen? And I think many people with back pain has the same thing. When I had back pain, I had the same thing, because the way I injured my back was bending over, picking up something, and to do a deadlift with the amount of weight that I do today, it was imaginable. Oh my God. But if you overcome that fear, that's amazing. So do you
Absolutely.
think that you were able to overcome that fear?
Well, I actually have a really incredible story. So it wasn't until I got into residency that I learned how to prevent my dislocations. And so, and just to give you a little reference, we have we have in physiatry, we have this scoring system called the Beighton score, and that's
Mhm.
how lax your joints are. And it's a scale out of 9, and my score is 9, so I'm 9 out of 9. I can do weird things. I'm
Mhm.
very bendy and
Mhm.
not a good way. And so, interestingly, I never went skiing because I was really worried about skiing.
I can imagine.
I could
I
just,
can imagine.
and so, um, I finally I found a incredible physical therapist when I was in residency, and I had access to incredible physical
Mhm.
therapists because I was
I'm
in the
sure. Yeah.
physical medicine and rehabilitation department. So I found the exact right physical therapist who understood. I mean, she saw me and she knew exactly what I needed to do. And that I was probably about 26 or so when I found her, and I worked with her for a couple of years. And now I feel a lot more freedom. Like, for
Mhm.
example, I'm going skiing next month. The first time I went skiing was when I was 28, and where I went to undergrad and medical school was just 2.5 hours away from some of the best skiing in the world. And I deferred on all of those trips, and it's just once again, I mean, I'm not sad about what I missed out on, but I look at my children. I want them to have that
Mhm.
experience. We had a snow day, a snow weekend here in Dallas this past weekend, and they were sledding down the snow. They're so excited about the idea of skiing that we're going to go skiing. They're going skiing for the first time next month, and I want to be on the slopes with them. I want to be with
Yeah.
them. I want to see the joy in their face. I want to see the joy of movement, and I don't want them to be
Mm.
afraid of learning new activities and trying to find their passion. And I look back at myself and I said, basically for a 12 to 14-year period, I said no to practically everything. And so I don't even know what I could have been good at and what I missed out on. I just missed out on it. And, and so I want a little bit better for my children, because I know that they will find a lot of activities that they love, and it will help foster a healthy relationship with moving and exercising and being healthy.
That is an amazing goal, to be there for our children. You just said it. I don't work out because I enjoy getting up early in the morning before my son gets up. I just do it because I want to dance on his wedding, and I want to be able to help him when he has kids, or being able to do stuff on my own, not to rely on other people when I get older. And I need to start doing it now.
Absolutely.
Not 20 years later. I need to start building the strength, the mobility, the flexibility. And you just said it, why you work out.
Absolutely.
So, Dr. Ozarkar, when someone comes to you with back pain or chronic back pain or any back pain, how do you start building a treatment plan for them? What are the key factors you look at?
That's a great question. So the first thing I want to learn about them is what they know about how to move their body, what type of physical therapy or chiropractic or Pilates classes or whatever, what they have done in the past. Because some patients come to me and they are experts in their body. They know how to listen to their body. They know what feels right, what doesn't feel right. They have a routine. They've hit a block. And so I know how to help those patients. Then there are some patients who it's very clear that even if they've gone to endless sessions of physical therapy, or they've done a lot of treatments with chiropractors or physical therapists or whatever professional, they just have no idea about what their body is telling them. They find it very difficult to even describe their pain. They find it difficult to describe what causes their pain, what elicits their pain. And so I really try to assess where we are, because there's some patients who have zeroed in on everything, and they're so attuned with what they need. And of course there's always room for improvement, and I want to help guide them, but I don't want to waste anybody's time. But unfortunately, what I also see is plenty of patients who may think they have an understanding. They're like, well, I know how to do the figure of four stretch for my SI joint. Well, the SI joint, for example, is a complicated joint, and there are a lot of intricacies in the anatomy. Sometimes there's muscle involvement. Sometimes it's purely the joint. Sometimes it's ligamentous laxity. And a patient should be empowered to understand, well, I feel like, my SI joint feels a little out of place because I think there's extra motion there. I think I need to do this type of exercise or this type of relief position versus that type. And so what I see commonly is people who have, who know just enough to be dangerous, who've been to, 40, 50, 70 sessions of physical therapy, and are basically just handed printouts every single time. And they don't understand, well, when this happens, I need to do this. When this happens, I need to do that. And that's what I want to help them build with the right team. And then, of course, if they hit a block, if they hit a roadblock, which I see commonly, then that's when I want to talk about interventional care. So I want to assess where they are, and I want to make sure that I can hold their hand and help them get to the right professionals to get them educated enough about their situation so that they can handle the day-to-day problems that come at them. And then I build a broader plan for them that may include intervention, may not, to make sure that the tissue is as resilient as possible as they age.
Okay. Do you educate your patients on pain being multifactorial?
Absolutely. And I commonly break it down. There's a component of pain that is that the brain perceives. there's a component of pain that is structural, and there is a component of pain that can be magnified by other things happening in your life. And so I want to dissect some of that out with a patient, but I also want to help them understand, sometimes if it's clearly structural that's causing this acute pain, well, then we need to take a different action than my chronic baseline always nagging pain, which I know structurally everything is intact. It's just my brain, some people's brain tends to magnify pain. And so really helping a patient dissect that out so they feel empowered. So once again, when they're at home and they have some sort of acute episode and I'm not there and nobody is there and none of their PTs or chiros or anybody are there to help them, I want them to feel empowered to say, I know what this is. I know the basic 1, 2, 3 steps. And if it's still not improving, then of course I have my team of professionals around me that I can access. But that's a big part of that is, since pain is multifactorial, patients need to be empowered to understand the basics of, all right, if this happens, I need to do 1, 2, 3. If that happens, I need to do 1, 2, 3. And they just need to know what to do. And that's part of understanding the multifactorial nature of chronic pain.
Yeah. Many patients and many of my clients think that pain equals to injury. If something hurts, I must have done something wrong. So the first question, if I see someone or someone comes to me, is, did you fall in the last 2 weeks, for fracture? And, if is everything going okay under the belt or below the belt for coda equina, because those are the clients or patients that I'm not allowed to, and I won't even treat. Actually, do you treat patients with coda equina?
So I don't do the definitive treatment for them, but I'm happy if anybody is concerned about that. I am absolutely happy to facilitate the workup and point them in the right direction, because it is so hard as a patient to just call up a surgeon and expect to, and in today's world, it is really difficult to see a specialist and see the right specialist. And so I'm always happy to help triage some of this, help get something worked up, facilitate ordering an MRI as quickly as possible, getting the result as quickly as possible, and telling the patient exactly what step to take next, because I'm plugged into this world. And so, and patients aren't. And so, so of course I see patients for that. I don't do the definitive treatment, which may be surgery. But I absolutely see those patients, and I'm happy to hold their hand and walk them through the process, because it's scary.
Yeah. Thank you. Now, how do you decide if someone would benefit from treatments like injections versus other therapies, such as physical therapy or anything that you do? How do you decide which treatment works for them?
So I want to assess what what they understand about their pain situation, but B, one thing that my line in the sand is typically sleep. If a patient can't sleep, then I need to do something about that, because sleeping is healing. And that's how you drive yourself crazy, and that's how you magnify things like anxiety and depression and PTSD and any other underlying things that a patient may have in the background. And that's how you magnify pain. Any one of those mood disorders, any one of those kind of anxiety type of conditions can magnify pain, and it can really make someone spiral out of control. So if someone is having trouble sleeping, then I'm not going to make them try to learn a bunch of, and they're like, maybe I've done some physical therapy, maybe I haven't. Then I say, okay, you're in my hands for a little bit of time. Let's at least let's consider an injection. Let's consider certain short course of medications so that we can get your sleep kind of on track. It doesn't have to be perfect. I'm not trying to get everyone 10 hours of sleep every night or anything like that, but I want people to have relatively restful sleep so their brain can function. And then that's when we may consider, engaging physical therapy. But typically, if patients are like, well, the back pain is bothering me, or the chronic pain of whatever type is bothering me, my sleep is relatively usual, my life is relatively usual, then that's when I kind of take it a different direction and say, you really need to know all that you can about your body and optimize as best as you can. So, and with the way I frame it for patients, because many times they may see me as the injectionist, the needle jockey, the person who's going to, do procedures for them. I say, at the very least, we know that prehab, rehabilitation prior to any type of intervention is going to improve the efficacy of that intervention. So if you have not prehabbed properly, then you're not going to get the biggest squeeze out of what I can do for you. And so, so that's kind of how I frame it. But once again, sleep is my line in the sand, and I want to make sure that patients get enough restful sleep so their brain can work, so they can even do prehab or learn anything from it, or interact with whoever they need to interact with throughout the day, because that's what I have found is, that's where I kind of throw away the insurance script and say, look, if you haven't done 6 weeks of physical therapy, but you can't sleep because this pain is so bad, come walk with me. Let's try to figure something out. In the meantime, of course, getting stronger and moving is always a part of the solution, but we need your brain to function so that you can move forward.
Absolutely. And it's very interesting you said that, because if you don't sleep, not enough sleep can actually lower your pain threshold. And
Absolutely.
Research actually supports that as well. And for example, when you have a newborn baby, right? Moms, you don't sleep enough, and everything is bothering you, right? Even when your husband is eating and chews the food, you're like, because it really amplifies everything, right? You get angry, you're irritated, and you're just tired all the time. And the last thing you want to do is work out.
Yeah.
Like the last thing you want to do is to move your body.
Absolutely.
Right? I had episodes of very bad back pain, and the last thing they said, oh, movement is great. Not when you crawl to the bathroom.
Yeah, absolutely.
I'm so happy that you emphasize physical activity, because at the end of the day, and you mentioned that they get better results if they start doing anything. They make their body stronger and more resilient. So we literally cannot really get away without working out, right? Or doing anything physically.
If you don't move it, you lose it.
That's it.
It's as simple as that.
Love that. Perfect. So are there any newer or emerging treatments in pain medicine that you're particularly excited about?
Absolutely. So so part of my role as a board member for the American Academy of Orthopedic Medicine, part of my role as medical director at the Reardon Medical Institute in Southlake is performing interventional orthopedic injections that really focus on regenerative medicine. And so examples of regenerative medicine include prolotherapy, and that's where we take sugar water and salt water and lidocaine and try to create an inflammatory response in some of these areas. I also use energy medicine. So for example, we have a device called the soft wave device. And so it takes powerful sound energy and concentrates it and blasts it through the tissue and gently agitates that chronically injured tissue. There are lasers that we commonly use, that we have in Southlake and are widely available. Electromagnetic field stimulation is also helpful. So so there's within regenerative medicine, there's I kind of see three major branches. There is energy medicine, like I described. So like lasers and the sound wave energy types of treatments. And then there are autologous treatments. So that means that we use the patient's own body to treat themselves. So we will harvest their bone marrow aspirate, which has a concentration of mesenchymal stem cells, the healing type of stem cells. So we'll take their own bone marrow, either concentrate it or just aspirate it and inject it into certain areas. and then there's also PRP, which is where it's called platelet rich plasma. We take the patient's own blood, we concentrate the platelets and some of the other growth factors that exist in their own body, and then we inject it into an area that really needs to catch up. And then there are many sources. There are emerging sources. For example, your dental pulp has stem cells inside of it. And interestingly, those stem cells work a little differently than your bone marrow stem cells, even though when you look at them under the microscope, they're the same stem cell. But one, which is the bone marrow stem cell, has been living next to nerve and bone its entire life, so which is really potentially helpful in spine care. The other, bone marrow, lives around blood cells all the time, and so those cells are really good at new blood vessel formation or angiogenesis, which is a big part of the healing process is blood flow. When an area is chronically damaged, it lacks access to blood flow, and that's part of the what causes the symptoms. And so we are just barely scratching the surface here. Many of the answers to various ailments in that we face as humans today the answers are found within our body. We just need to know how to safely harvest it, safely do what we need to do in the lab to make sure that we optimize the patient's own cells, and then safely learn how to give that back to the patient. And so there's still a lot to learn there, but we are doing emerging therapies at my clinic in Southlake, some clinical trials, some trying to move medicine forward that way. And then the other branch of regenerative medicine is what we call allogeneic, so not from your body. And so that's where, so for example, we have a clinical trial, an upcoming clinical trial in the Cayman Islands, where I'm also licensed to practice medicine there. And so that's where we take umbilical cord stem cells and we grow them out in a specific way. And then right now we're doing we're focusing on low back pain, so intradiscal injections where we inject those stem cells directly into the disc. We inject it into the epidural space. We inject it into some of the muscle groups that need a little bit of catching up, some of the ligamentous tissue, and try to lift all of the anatomy up together. So it's there. That is still all investigational and experimental, but many of the answers to our problems lie there. And what I can tell you right now from personal experience, being a patient who's gotten stem cells, being a family member of someone who's gotten stem cells, my dad, what I'll say is, if you don't do the rehab, then you are blowing your money. And you're blowing your time, and you're blowing all the recovery that you have to do after stem cell procedures. And so what I tell those patients in particular is, you need to do your homework before you come do this. You need to know how to move your body. You need to know which areas we have to address. And the only way you really know that is by knowing your body. And you need to know what to do afterwards. And if you don't, then it's all a waste of money. And I'll tell you my dad's experience. He's had SI joint pain for a while, and I've injected him with, me or my colleagues have injected him with steroids before. I've done prolotherapy. He's even gone to Stem Cell Institute in Panama, and he's gotten culture expanded mesenchymal stem cells derived from umbilical cord injected into the SI joint. But what he didn't do was the physical therapy. And of course, he had been to physical therapy multiple times, but it's one of those printout physical therapy places where they're seeing 4 patients at a time. They give you a printout. He didn't understand what was going on. And finally, it's hard for my parents to go outside of the insurance world, but I dragged him to a wonderful physical therapy group that's in the area, and it's totally changed everything. It's made my interventions way more successful. It's made him want to get up and move more, because every time he stood up, his pain would be present, and so he would just sit, and that's the worst thing a 75-year-old can do. And so what I've learned is that it is so important to move with these emerging fields, because these emerging fields are trying to bring blood flow, they're trying to bring healing, they're trying to rebuild some of this tissue. And if you don't tell those cells what to do, and if you don't tell them how to organize and which direction to organize, and if you don't mobilize that joint and push some of that old synovial fluid out so new blood can come in, then you are wasting your time and money. And so these emerging fields in medicine, particularly in musculoskeletal medicine, a prerequisite is movement and knowing how to move and what to do.
And I do believe it's also important to find the right person, because you mentioned that the physical therapist your dad used to see, it didn't work, but then you found someone else for him. So it is really important, because you can also, you feel it, who's right or who's wrong. So always listen to your guts, right?
Absolutely. Absolutely. And if you need to, and what I say is that your first consultation with a doctor, with a Pilates instructor, with a personal trainer, with whomever, is the interview. And it's okay if you're not married to them. If you don't want to proceed with them, go find someone else that works with you. That's it.
That's what I say. If I see someone, if you don't like me, if you don't like the vibe, you're never going to like me. So you can find someone else. It's all good. We don't have to love everyone.
Yeah, absolutely.
That's all right. In a recent 2024 meta-analysis, epidural steroid injections were shown to be effective in relieving sciatica caused by lumbar disc herniation in the short to medium term, and can also help reduce opioid use. However, they didn't show significant improvements in overall limb function. From your experience, how effective are epidural steroid injections for people with chronic low back pain?
So I as an interventional pain physician, I've done thousands of steroid injections, thousands of epidural steroid injections for that matter. I tell every patient that a steroid is a bailout, and I equate it to a title loan or a cash advance type of loan. If you need one or two throughout the course of your life, if you need a couple here and there, you're not a criminal. You'll be able to catch yourself back up. But if you do it every month to pay rent, then it's not going to work out, and everything is going to fall. Your entire world is going to crumble. And so the overuse of steroid injections will destroy your body, hands down, no questions asked. That all of the evidence indicates that. However, if you have acute pain, if you are crawling to the bathroom, if you can't even think about sleeping, if you have burning, fire down your leg because you have acute lumbar radiculopathy, or acute on chronic lumbar radiculopathy, which means if you kind of always have this pain and then it just suddenly really flares up, that is the time to consider a steroid injection, because it dampens the pain, so the real big uptick in pain, and it makes you functional for a short period of time. But those steroids are consumed by the body. They're evacuated from the epidural space over the course of weeks to months, and while they're working, they help shrink up some of the tissue temporarily, but it's just a bridge to find a long-term answer. Once again, if you need to take one of these short-term high interest loans to bridge you for a month because 5 things happened to you that it was just a perfect storm of funny things happening, and you're going to catch yourself up for the rest of the year and the rest of the decade, then no problem. But once again, if you're doing it all, if you're taking several of these loans out a year, then it is going to come bite you so hard. And that's what I see with steroid injections. I see my patients that I've known for years who really can only do what the insurance company asks of them. Part of it is that they don't know how to move properly because they can't find that right person or don't want to or whatever, and they rely on these steroid injections. The other thing about steroid injections is that steroid injection number 1 typically is magical. Steroid injection number 17 is basically works at way less effectively than the first one. And so that's part of it as well. So typically what I find with any type of steroid, we're talking about epidural steroids, but even joint steroids, is if you as a patient are in an incredible amount of pain and there's a huge uptick in pain and there's nothing, a doctor has safely ruled out infection or fracture or any of those types of nasty things, then yeah, a steroid makes sense. But it is only going to bridge you for a period of time. And if you do it over and over and over and over again, then you're going to lose.
Mm-hmm. Isn't it because you need actually more than the first time? More dose, or how does it work?
So, part of it is, yes, there are some pain physicians who want to do a dose escalation strategy, meaning that they start your first epidural steroid injection may be at a lower dose, and the second one may be at a slightly higher dose, and so on and so forth. But also, every musculoskeletal problem, acute or chronic, I visualize it in 3 buckets. There is the inflammatory bucket, which something is inflamed, and that's the only place that steroids help. There is the biokinetic component, which is, your knee bones connected to your hip bone, all of these joints in this kinetic chain are related to one another. And so you are more prone to injuring one and the other. And you have to focus on, planting your foot properly and engaging your muscles properly when you do certain activities. So that's kind of the biokinetic bucket. And then the final bucket is the structural component. And so if there's a huge disc herniation that's, let's say 7 millimeter disc herniation that is just strangling your nerve root, physical therapy is not going to make that go away many times. And a steroid injection is also not going to make that go away. So you need to go to a provider who is going to help dissect out, all right, how much of this is structural, how much of this is biokinetic, and how much of this is inflammatory. And steroids only help with the inflammatory piece. And so if you have a provider who is not thinking things through and is just very algorithmic in their approach, then they're just going to say, well, the last steroid injection was okay, and it gave you some relief. Let's give you more and see what happens. Well, you have to take a step back and say, maybe we handled the inflammatory part of your disease. Maybe you're left with biokinetic, which is something that you focus on, moving your body correctly, or maybe it's structural. And so you always have to have a provider who is going to take the next step with intention. Most of them are not thinking that way. And so they say, well, last time I gave you 10 milligrams of dexamethasone, let's try 20 milligrams of dexamethasone next month and see what happens. And maybe it will give you a little bit better result, possibly, but maybe your doctor needs to go back to the drawing board and be a little bit more intentional in how they're treating you.
So disc herniation has a natural history anyway. They usually heal between 12 to 18 months because they are probably less vascularized than the bone. So that's why it takes longer, right? And also we have many people with disc herniation without any problem. They are pain-free. So even evidence and research suggests that, or backs it up, that many people, maybe I had disc herniation when I was in my early 20s. Maybe I still have it now, but I feel okay. Maybe you have a couple of disc herniation, but we don't know about it because you're pain-free.
Yeah.
But so it's a gray area, right? I mean,
Absolutely. And one more thing I'll say about steroids is steroids also encourage fibroblasts. Fibroblasts are the cells in our body that produce scar tissue. They encourage fibroblasts to work at full speed. And so, whereas our normal body is not trying to do that. And so, kind of the natural history of a disc herniation, the annulus, which is the outside layer of the disc, gets cracked, and the inside portion, called the nucleus pulposus, will seep out and either chemically agitate or physically agitate nerve roots and structures in that area. Well, your body is trying to mount an immune response in that area. Your body does not like the crack in the disc, and it sends white blood cells into that area to try to eat up that disc material. Now that is creating an inflammatory response as well. But when you douse it with steroids over and over and over again, then instead of having white blood cells in that area trying to eat up that disc material, and for your body to try to consume that disc over the course of that 1 year to 1.5 year period, like you were mentioning, all of those steroids are now encouraging fibroblasts to work instead of white blood cells. So you just create a bunch of scar tissue, and you can imagine scar tissue as all the cobwebs and the parts of your attic that you've never been to. And it wraps around these structures and it reduces the motion in the deepest parts of your back. And so that is going to be a major hindrance, maybe not the day after the steroid injection, but when you look at 10 years out, when you look at 50 years out, then yes, it does play a role, because all that scar tissue that is accumulated from the initial injection is going to affect you in the future, and affect your ability to move and function in the future.
I had a client last year. They were trying to get her off from opioids because she's been having terrible back pain. And she tried the epidural steroid injection, and I was worried about her because she usually shows up to class, and I didn't hear about her for a couple of days. And she said after the epidural steroid injections, she could not move for over a week. And they didn't even tell her that this can happen, the side effects. So imagine they are trying to get her off from opioids. She was actually excited to move, but she couldn't for over a week, and she got really depressed again.
It's and once again, and and I will always, I'm not trying to attack my fellow physicians here. Sometimes that is not usual for someone to have such an unpleasant experience after one of these injections, but it certainly can happen, and that's just kind of the practice of medicine. Sometimes funny things happen, but also, if we look back and if we thought, did that doctor look at did they move with intention? Once again, did they evaluate her fully and say, maybe some of her back muscles may have been in spasms since 1997, and if I put a very thick needle through all of those back muscles, is that going to be a good thing or bad thing for this person? Should I maybe try a different approach? Should I take another angle? Should I go lower and where I don't have to go through all of so once again, it's all about finding the right professional who's going to think about these things and say, I feel like you may be at risk of having a bad episode after this. Maybe let's try a different approach, as opposed to someone who's seeing a lot of patients every day and doesn't have time to treat every patient like they would treat their mother or their aunt or their family member.
Yeah. Okay. Thank you for explaining that. Yeah. Now, reducing opioid use is a big win in pain management. Why is this important?
Well, opioids have a host of issues that they cause. First, they're known to change your personality and your ability to enjoy life. Chronic use of opioids. Beyond that, there are hormonal implications. There are just all-cause mortality. So the risk of dying from any reason, whether it's cancer or a heart attack or being hit by a bus, if you're on chronic opioids, your risk of dying is just higher. It's just higher than if you weren't on opioids. And so, and of course, it affects your hormones and your bone density, your bone mineral density, and your cognition. It puts you at risk of losing your memory as you age. So I could go on and on about the deleterious effects of opioids and steroids, for that matter. But with opioids in particular, the other disconcerting part is that we have opioids in our body. We have an endo-opioid system that our body engages, and if we are constantly exposed to opioids and those receptors that those endogenous receptors that naturally live inside of our brain are constantly inundated with opioids, then our brain's perception of pain, our brain's perception and pain of any type, physical pain, but also emotional pain. Our brain does not is not able to perceive threats, not able to perceive pain properly. And sometimes pain is a motivator. Sometimes emotional pain is a motivator. Sometimes physical pain is a motivator. And sometimes you need that to be a little fire under your bum so you can move forward. And unfortunately, opioids, especially when your brain is constantly exposed to them, it just alters your brain's ability to understand what the next best step is, whether that is driving in your car and whether to swerve or not swerve, or making big financial decisions or making emotional decisions. Everything is altered with chronic use of opioids. So it just changes the course of your life. And I'm not saying that there are no patients that would benefit from long-term opioid use. I have so many examples of patients who are just in a terrible situation, who this helps them get through the day. But most people, the heavy majority of people on this earth, should not be exposed to really any drug every single day, but opioids in particular just warp almost everybody's ability to function properly.
Yeah.
And so that's the most disconcerting part about long-term opioid use.
You said something very important, that sometimes we do need pain, and pain can be protective, right?
Absolutely.
For example, when you are doing something, even a Pilates, and we want to do a back bend, but the pain stops you because you're not ready for the movement. So the pain is protective and can be protective, and it's important. So pain doesn't necessarily mean it's a bad thing, because it's part of life. We experience pain, right? Physical and emotional pain as well.
Absolutely. And that's, like we've been talking about, learning to learn your body, read your body. Sometimes emotional pain, even though it pierces harder than even physical pain in many instances, sometimes that emotional pain helps prevent you from making a bad decision in the future. And so sometimes we need any of these pains, right? Whether it is lifting a box or doing something new in Pilates, or starting a new relationship with somebody. And if you don't have those warning signals in your brain to help you make a decision, then sometimes you can make bad decisions, and that can lead to a lot more pain and suffering.
Exactly. But I always do believe in pain, or exercise within pain tolerance. That's really important, right? So you don't have to push through the pain.
Absolutely.
Little pain is okay, the one you can tolerate and manageable, right?
Absolutely.
So that's really important. Now, in pain management, where do you see the role of physical activity and exercise fitting into the overall treatment plan for back pain or any type of pain?
I would say for 90% of patients, it is important at the beginning, middle, end, and forever. You need to learn how to move. If you are a very early beginner, then you need to be learning relief positions while we're trying to get. So for example, that patient who has 10 out of 10 pain, can't sleep, can't think. Well, even for those patients, while I'm doing my processes, thinking about medications that can give you short-term relief, working things up, getting, imaging ordered or whatever, planning on doing an injection, you need to see a movement specialist who will teach you relief positions. Just basic, like, this is what I do when I'm in excruciating pain. This is the relief position that I know is safe, that I can take. If you're in the middle of your journey where you're kind of dealing with chronic back pain and you just have to live life, well, then you need to learn a lot more about your body, and you need to learn how your body can move so you can make it stronger and more resilient. And so in every part, if you're seeing me, then you better have a great relationship. And I don't care who it is. I don't care if it's the top notch physical therapist who knows everything. I don't care if it is a personal trainer. It's just somebody who understands your body, who's going to be able to guide you. You need to be working with somebody else, because I am talking about the imaging. I'm talking about the science. I'm talking about interventions. I'm talking about if we need to plan for surgery. That's my role. You need to have someone else who is going to teach you the day-to-day activities of learning to live with this pain, making yourself stronger, teaching these cells in your body how to be less inflamed and more productive. And so you really, that's kind of my contract with patients is you absolutely need someone who is going to guide you on a day-by-day basis and learning how to move. No questions asked. And then, because otherwise everything I do is a waste of everyone's time and money.
So we cannot just sit all day and complain about back pain, go and see you, and nothing gets better, right?
Absolutely. That is one of the most upsetting things to me. And I don't, look, I'm not here to, I never chastise patients or anything like that. But realistically, that patient is going to lose. They're going to lose money. They're going to lose time. They're going to lose function. And, if they're not moving, they're just going to lose, hands down.
But people usually look for a quick solution.
Well, I wish I could get rich quick. I wish I could fix all my problems quickly.
Within a day.
Nothing, exactly. That is not how complex problems in life work. Complex problems in life take a complex answer, take a lot of foresight, take a clear mind, take a resilient mind. And so that's the mindset that you need to be in, because if you don't have that mindset, it will consume you. The pain, the just not being able to participate in life like you want to will absolutely consume everybody. Even if it's not on day 1, even if it's not on day 30, eventually it gets to everyone. And so, complex problems need a complex solution.
And you already answered this question. How does physical activity complement other pain management treatments like injections or medications or anything? So,
absolutely. And what I'll say about this one more time is prehab, getting your body as strong as possible before any type of intervention, whether it's surgery, whether it's injections, whether it's whatever, it is going to improve your outcomes. You need to do this safely. You need to do the prehab safely. For some people, it's just getting on the floor and learning how to do cat-cow. Some people can't even get on the floor, but it doesn't matter, because you need a movement specialist who can guide you through what you can do. But anything you can do to make yourself even a little stronger is going to absolutely optimize your outcome with whatever procedure or surgery or whatever you may need to do.
But people usually think that when I get pain-free, I start doing something. But you are saying it the opposite way. So maybe they need to do something they can do now. They can have the whatever treatment they need, and they can do more and make their body stronger and more resilient.
Absolutely. And after prehab is rehab. And that is and what I write on every single physical therapy prescription that I write is you need to build a home exercise program for this patient that they can do anywhere, wherever they are in Timbuktu or visiting Europe or at their home. They need to be able to do it practically every single day. And they need to be able to strengthen their tissue long-term forever. And so that is my absolute prerequisite of any movement specialist that I work with, and frankly, patients as well. So the prehab is important, but if you want to get injured again and go through all of this all over again, then the best way to do that is by not rehabbing it and not even when you are pain-free, learning how to strengthen this tissue as best as you can. If you don't do that, you're going to come back and see me, and we're going to call you my little annuity who's going to come back and see me every year and get injections with me. Or you can take it into your own hands and you can make your body stronger and hopefully never have to see me again for that problem.
Why do you think when people experience pain or back pain, exercises or anything they do has to be accessible? You mentioned that, write up a program plan they can do anywhere, anytime. Why do you think that it is important?
because spine pain in general, and any type of chronic pain, but back pain in general, back pain is always the big puzzle that no one's ever been able to figure out. It's a very complicated, no matter how simple someone makes it sound, or no matter how simple you think it is very complicated. And if you are not hacking away at that problem little by little every day, and all I'm asking is 5 to 10 minutes a day for people who are in the maintenance phase of their disease process, 5 to 10 minutes a day, just like you would say and do something nice for your spouse, or just like you would say or do something nice for the family member that you live with. Once a day, every day, you do something nice for the people that you love. You love your back, do something nice for your back once a day. Not all day, 5 to 10 minutes. It's all I ask.
Exactly. This is actually why I created my program. I used to see clients and patients, physically, but I changed my business from being, having classes physically to online, because people want something that is more accessible from anywhere. They don't have to worry about driving, parking, time. So this is why, and it is working. They love it.
That's incredible.
I only work with women with back pain, and maybe that's why they love it, because it's accessible. They can do it even when they are on their vacation. They don't need anything, and they just feel better. So probably that's why, because it's accessible and they get to move their body anywhere,
Absolutely.
anytime.
And they're empowered too. They understand their body, and they know that if they ever hit a wall, if they ever go back into that hole that they were once in, that they have the basic tools to try to climb out of that hole as best as they can. And so a big part of this is empowering patients as well. And that's probably the biggest thing that you do, is that you empower them so that they know with confidence that they can do certain activities and not pay for it. And so that's an incredible thing, like an incredible gift that you give them.
Is it important to maintain movement and exercise even after pain levels decrease?
Absolutely. It is essential. Like I said earlier, just like whoever you live with at home, you should try to do one nice thing for them every single day. It doesn't have to be big or small. It just has to be something. You should do something nice for the part of your body that wreaked havoc for a period of time. You should treat it with love and respect. And the way that you do that is by doing your home exercise program that has been designed for you by a movement specialist that you have worked with, tailored for your certain situation. Okay. So do something nice for the part of your body that barks at you sometimes.
Exactly right. Now, what long-term benefits do you see when physical activity is integrated with medical interventions?
So just longevity in general, right? Being your body being resilient for aging. Aging is very difficult. It's very difficult mentally. It's very difficult physically. Some people age gracefully. Some people don't. If you would like to age gracefully, which I promise is the way that you want to age, then you need to move. It's good for your brain. It's good for your body. It's good for, let's say, if you've had back pain for a period of time and you're in a situation like Bernadett, where you've kind of overcome and conquered the worst of it. The more you move, because you've had back pain, you are now at risk of having problems in your hip. You're having risk of having problems in your neck, in your knees, various other problems. When you move, you mitigate the risk of those other parts of your body from failing. And of course, the more you move, the more you train your heart to contract efficiently, the more resilient you are to problems that eventually, older folks are prone to, like heart failure and other metabolic type of issues. And so movement mitigates so many risks, and it helps you age gracefully. And if we're on this earth, and if you're blessed to wake up every morning and be on this earth, then you want to do it gracefully, because you never know what life has in store for you. And the best you can do for your body is to be as strong as possible for tomorrow.
Yeah, absolutely. I agree with that. And also, when we exercise, the body is releasing endorphins. And what are
Absolutely.
endorphins? We were just talking about opioids, right? Our
Absolutely.
body is natural painkillers, right? And we also sleep better when we exercise, right? It helps us to sleep better. It can. I'm not saying it will, but it can help you to sleep better as well. And you just feel better generally because you moved your body, right?
Absolutely. You love harder, you love more intensely. People who have a healthy physical lifestyle are just much more likely to be fulfilled in their personal relationships, whether that's a romantic relationship or a parent-child relationship, or whatever the situation is. You love deeper when you are exposed to these endorphins, and your body is has access to them, preferably once a day, or a few times a week. It changes your brain and body chemistry so that you're just much more fulfilled all around.
Yeah, you're generally happier. If you ask anyone in the gym why do you work out, they just love how they feel after they finish the exercise. I don't run because I love running. I just love running how I feel after I ran,
Yeah.
because it's just, oh, I did it.
Yeah.
And I you don't necessarily, well, when I do Pilates, I love it, but running is not my favorite. But I do it as a cardio, but not every day, maybe twice a week. you
Yeah,
know
absolutely. But that's that little bit of exposure that you are giving to your brain and body just on a chemical level alone is it is you will be paid dividends on that forever, just even doing it a couple times a week. And
Yeah,
it's a chore for me as well.
yeah.
But I do it, and I've
Discipline,
it's discipline.
discipline.
Absolutely. It's 30 minutes a few times a week. It's not I was just going to sit and watch TV anyways. I might as well do it while I'm moving. So that's not
Exactly right. Now, are there any small daily habits or changes you recommend that can make a big difference for someone with low back pain or back pain?
beyond the things that we touched on already in this interview. I think that trying to be a little bit more thoughtful about what you put in your body in terms of food.
Mm-hmm.
Highly processed refined sugar is super duper inflammatory. And yes, I mean, no one loves chocolate more than I do. No one loves ultra processed food more than me, or maybe my younger daughter. But it all of these things, whether it's highly processed corn products, whether it's highly processed sugar products, highly processed products in general
Mhm.
tend to generate more inflammation in your body, and inflammation begets inflammation. The
Mhm.
more inflammation that you have in your body, the more prone you are to more inflammation. Inflammation is the biggest driver of aging,
Mhm.
and of course biggest driver of musculoskeletal pain. And uh, and so if you are, for example, signed up for an epidural steroid injection because you're back, because you have fiery pain down your leg and you can't sleep, and you turn to highly processed, ultra processed foods during that period because you're like, well, I'm sad, I'm just going to
Mhm.
eat all of the terrible things. And we don't have to talk about what the terrible things are. We all know what the terrible things are. Um, if you turn to that, you are fueling all of the fires in your body. The fire in your brain that can't stop thinking about the leg, the fire in your leg that's caused by the disc
Mhm.
herniation. All of the fires in your body are just being fueled by making poor decisions in terms of what you put in your body. And so a big part is ultra processed foods, and in particular
Mhm.
refined sugar. And then of course all of the bad habit things that we know are bad habits, drinking in excess, smoking,
Smoking.
all those things are absolutely terrible for you. And I know they have a grip on us. They have every time I go in the pantry, I have to, I have to put my blinders on and say, no, I'm not eating. Why am I eating chocolate? I'm not going to eat chocolate right now. I'm not
Chocolate
going
is
to
not
eat.
even that bad
Well, no, I mean,
compared to
well,
French
no,
fries.
yeah, the French fries or the cookies and
Yes.
absolute the ultra processed stuff that those are the types of things that are absolutely fueling practically every problem in our body, and the younger you are, the more resilient you are to it. But
As you age, it gets
oh yeah, it magnifies. The problems magnify in terms of those bad habits catching up with you.
Yeah, I absolutely agree with that. And you just generally feel again better if you eat healthier. And I'm not saying you can't have French fries or cookies or anything
Yeah.
every once in a while, because we have pizza day and a burger day
Of
and
course,
this and
yeah.
that. Everything in moderation is
Everything in
perfectly
moderate.
fine.
Absolutely. Absolutely.
Okay. Now, for someone who's starting their journey with back or with pain management, what's one piece of advice you'd want them to hear today?
Is you need to learn how to move. And that may change on a day-to-day basis as your condition changes, but you need to know what the safe movements are and what the unsafe movements are, and you need to move at least a little bit. You need to, toe that line so that you can really ask that part of the anatomy to get re-engaged with the rest of your body. And so learning the safe movements for your particular situation, there's no way around it. And there are a lot of ways to do it. You can get with a professional, or you can empower yourself through listening to podcasts like this. Or a combination thereof is the best approach. But you need to learn how to move. Otherwise, everything will spiral out of control.
So moving within pain tolerance is a good advice, right?
Absolutely.
Okay.
Absolutely.
Thank you so much.
Thank you for having me. Yes.
Thanks for listening to the Back to Movement podcast with your host, Bernadett, and our very special guest, Dr. Tejas Ozarkar. I hope you enjoyed this episode and all the insights you learned about regenerative medicine. That's all for this episode, folks. See you next time.